Alright? Kindly open your Tortora para makasabay kayo sa discussion. Let's start with the blood and nerve supply. Now, the kidneys are critical organs for waste removal and the regulation of blood volume, ion balance, and pH. For them to be able these essential functions, kailangan nila ng significant blood supply. So, nakaka-receive sila ng 20 to 25% ng body's cardiac output. So, tingnan natin ngayon yung renal blood flow and yung vascular pathway. Let's start with the renal arteries. Ang renal arteries kasi natin, meron tayong right and left na magba-branch off from the abdominal aorta na magde-deliver ng blood to the kidneys. Kasi ang kidneys natin, less than 0.5% lang yan ng total body mass. Pero nakaka-receive sila ng 20 to 25% of the cardiac output. So, approximately 1,200 ml per minute in adults. The renal artery then branches into segmental arteries that supply specific sections of the kidney. Now, each segmental artery provides blood to different parts of the kidney, including the renal lobes. So, the segmental arteries give rise to the interlobar arteries naman. No, yun yung nagta-travel between the renal pyramids. So, pag sinabi natin between the renal pyramids, yun yung tinatawag natin na renal columns. From the interlobar arteries, magiging arcuate arteries na makikita natin sa base of the renal pyramid. Kaya din siya tinawag na arcuate arteries kasi mukha siyang arc. No, meron siyang arc-like shape. From the arcuate arteries, magiging cortical radiate or interlobular arteries na mag-radiate outward into the renal cortex. So, from the cortical radiate or interlobular arteries, magiging afferent arterioles. Ang afferent arterioles yung nagsusupply ng individual nephrons. So, each nephron, nakaka-receive sila ng one afferent arteriole. This arteriole will divide into a network of capillaries known as glomerulus. Yung glomerulus, doon nagkakaroon ng filtration. Yung blood plasma mafi-filter para mag-form ng urine. So, from the afferent arterioles, di ba sinabi natin magdi-divide yan into glomerulus. Yung glomerulus kasi ball-shaped network of capillaries yan. Diyan nagkakaroon ng blood filtration. And unique yan kasi gitna yan ng dalawang arteriole. So, meron tayong afferent arteriole and the efferent arteriole. Pag sinabi naman natin na efferent arteriole, yun yung nagkicarry ng blood away from the glomerulus. Alright? From the efferent arteriole, magiging peritubular capillaries. Yun yung nagsusurround ng mga tubular parts ng nephron sa may renal cortex. Meron silang role sa reabsorption of substances. No, yung filtrate na nandoon sa may tubules, ibabalik natin sa may bloodstream. And then we also have a vasa recta and magkakaroon ng venous return. So pag sinabi natin venous return, yung peritubular capillaries and yung vasa recta, magre-reunite yan para mag-form ng cortical radiate interlobular veins. Yung veins na yun, magde-drain sa arcuate veins and then into the interlobar veins. Yung blood makokollect sa isang single renal vein na mag-exit sa may kidney at the renal hilum. Yun yung magkikerry ngayon ng deoxygenated blood pabalik sa inferior vena cava. Okay? Now, tingnan natin ngayon yung different parts of a nephron. So, pag sinabi natin nephron, yun yung functional unit of the kidney, meaning it is the basic structure responsible for filtering blood and forming urine. Each kidney, meron tayong 1 million nephrons. Again, each kidney contains about or around 1 million nephrons. So, ang structure kasi ng nephron, meron two main parts. Meron tayong renal corpuscle at saka renal tubule. So, unahin muna natin i-discuss yung renal corpuscle. Yun yung part kung saan nagkakaroon ng blood filtration. And meron tayong two components under that. Meron tayong glomerulus at saka yung Bowman's capsule, also known as your glomerular capsule. Yung glomerulus, yun yung small ball of capillaries. No, doon nagkakaroon ng blood filtration. Sa Bowman's capsule naman, or glomerular capsule, double-walled epithelial cup yan na nagsusurround ng glomerulus. Yan yung kung saan pumupunta yung mga filtered blood plasma. No, doon sila nagko-collect. Once tapos na sila sa may renal corpuscle, dadaan na yung filtered fluid doon sa renal tubule. No, filtered fluid meaning glomerular filtrate. Okay? Now, under the renal tubule, meron tayong three parts. Meron tayong PCT, meron tayong nephron loop or loop of Henle, and DCT. Okay, pag sinabi natin PCT, yun yung tinatawag nating proximal convoluted tubule. Proximal meaning closer yan sa glomerular capsule Convoluted meaning it is tightly coiled. So pag sinabi natin na nephron loop or loop of Henle, nasa gitna yan ng tubule and meron siyang hairpin turn na mag-extend papunta doon sa may medulla, no, pababa sa may inner part ng kidney. And we also have DCT or distal convoluted tubule. Distal meaning mas malayo siya sa glomerular capsule pero mas malapit siya sa collecting duct. Convoluted, ibig sabihin nun, kagaya ng PCT, coil din yan. So after niyang pumunta sa 3 parts ng tubule, mag-enter na yun sa collecting ducts. Okay, ano nangyayari ngayon sa fluid or filtered fluid doon sa mga tubule? So unahin natin sa PCT. Sa PCT kasi, efficient yan sa pagre-reabsorb ng mga substances pabalik sa blood. Ano yung mga substances na yon? Water, glucose, amino acids, salts. No? Efficient yung PCT natin sa pagre-reclaim ng mga ganong important substances. The next one would be the loop of Henle. Meron kasi tayong dalawang limbs. Meron tayong descending limb and ascending limb. Sa descending limb, ang nire-reabsorb naman dyan would be water. Sa ascending limb naman, ang nire-reabsorb dyan yung mga sodium, potassium, chloride ions. Walang water reabsorption dito. Kaya nagkakaroon ng concentration gradient. No? Ibig sabihin nun, nakoconcentrate yung urine. Mararetain natin yung water when necessary. So, pupunta na rin yan sa DCT or distal convoluted tubule. Nagkakaroon ng final adjustments dito, yung mga composition ng urine natin, kagaya ng sodium, potassium, calcium, hydrogen ions, nagkakaroon ng exchange between the filtered fluid and the blood. So, dahil dito, nagkakaroon ng acid-base balance at saka electrolyte level regulation. Now, makikita rin natin sa DCT or distal convoluted tubule yung role ng mga hormones kagaya ng aldosterone and parathyroid hormone sa pag-reabsorb ng sodium, calcium, parang ganun. Madidiscuss natin yan mamaya. Now, from there, pupunta na yan sa may collecting ducts and then pupunta sa papillary ducts and minor calyces, pupunta sa may renal pelvis. Okay? Now, meron tayong 2 types of nephrons. Meron tayong cortical nephron and meron tayong juxtamedullary nephron. So, ang cortical nephron kasi around 80 to 85% yan ng mga nephrons. And they're located in the outer region ng renal cortex. Mas short ang nephron loops nila. Hindi nag-extend far into the medulla. Nasa outer part lang. Nakaka-receive sila ng blood supply from the peritubular arteries. Okay? Now, the second nephron, yung tinatawag natin na juxtamedullary nephron, mga 15 to 20% lang yan. No, they are located near the junction between the renal cortex and the medulla. So, mas deeper sila compared sa cortical nephrons. Mas mahaba ang nephron loops nila. So, yung nephron loops nila nag-extend papunta doon sa may medulla. So, since mas mahaba ang nephron loops nila, mas kaya nilang mag-concentrate ng urine, which is very important kapag kailangan nating mag-conserve ng water like in dehydration. No? Kaya nilang mag-produce ng concentrated urine. No? Yung blood supply nila nanggagaling sa peritubular capillaries, nanggagaling din sa vasa recta. Okay? Dito tayo ngayon sa overview ng nephron and collecting duct histology. Pag sinabi kasi natin na histology, it refers to the study of tissues at the microscopic level. So yung nephron tsaka yung collecting duct, may mga specific types kasi sila ng epithelial cells that help them carry out their roles. Now, tingnan natin yung mga histology. Tingnan natin kung saan, or tingnan natin yung histological features ng mga yon. Let's start with the glomerular capsule or the Bowman's capsule. Meron yung 2 layers. Meron tayong visceral layer, meron din tayong parietal layer. So, yung visceral layer kasi, yan yung inner layer. No? Meron yung direct contact with the glomerulus. Now, this is made up of modified simple squamous epithelial cells called podocytes. No? Think of these cells as foot-like projections, mga pedicels na nagra-wrap around sa capillaries. Again, yan yung nagfo-form ng inner wall ng capsule. So, it helps tumutulong siya mag-filter ng blood kasi inaalaw niya yung water, mga small molecules to pass through, pero naboblock niya yung mga larger molecules kagaya ng proteins. So, next one would be the parietal layer, yun yung outer layer, which is made up of small squamous epithelium. No, yan yung nagfo-form ng outer boundary ng capsule and continuous yan sa rest of the tubule. Imagine nyo yung glomerular capsule, yun yung balloon, tas yung glomerulus, yun yung fist punched into it. So, makikita nyo naman yan sa mga illustrations dyan sa Tortora. Now, the space between the 2 layers, no, is what we call as capsular space. So, dito naman tayo sa renal tubule. No? The first one would be the PCT. Yan, sorry. Yan yung first segment ng renal tubule and it is lined with simple cuboidal epithelial cells. Meron ding brush border dyan. Pag sinabi natin brush border, mga tiny projections called microvilli nasa surface. Yan. Ang ginagawa ng microvilli dyan sa surface is to increase the surface area for reabsorption and secretion para mas kayang ma-reclaim ng PCT yung mga vital substances kagaya ng water, glucose, amino acids. No? Tsaka yung cells sa PCT actively working or actively involved din yan sa pag-reabsorb ng mga important substances from the filtrate back into the blood. Now, the next one would be the nephron loop or the loop of Henle. Meron tayong two main parts. Meron tayong descending limb and ascending limb. Now, unahin natin yung descending limb. Ang descending limb kasi it is lined with simple squamous epithelium. No? Yung type ng cell na yun kasi, it allows water to be reabsorbed into the blood para ma-concentrate yung filter as it descends. Sa ascending limb naman, medyo different kasi yung meron tayong thin ascending limb and meron tayong thick ascending limb. Yung thin ascending limb, yun yung first part. It is also composed of simple squamous epithelium. Pero sa thick ascending limb, which is the second part, from simple cuboid, nagiging simple cuboidal to low columnar siya. No? Mas matangkad, mas specialized para sa active transport ng mga ions, kagaya ng sodium chloride, pabalik sa blood. Okay, lastly would be the distal convoluted tubule or the DCT, which is lined with simple cuboidal epithelial cells. No, wala silang brush border kagaya ng PCT. Now, ang role ng DCT is for fine-tuning ng filtrate, including the reabsorption of sodium, potassium, calcium ions para ma-regulate natin yung acid-base balance. So, from the DCT, of course, we have the collecting ducts. Yun yung last part ng nephron system bago maging urine na talaga yung filtrate. And this is lined by simple cuboidal to columnar epithelium. And may makikita tayong two cells dito sa collecting duct. Meron tayong principal cells and intercalated cells. Pag sinabi natin principal cells, meron silang receptors for hormones like ADH or antidiuretic hormone and aldosterone para ma-regulate yung water and sodium reabsorption. Sa intercalated cells naman, mostly on acid-base balance kasi sila yung nagsisecrete ng hydrogen ions or bicarbonate sa filtrate. Now, a key point to remember here is that nephrons do not regenerate. No, hindi sila nag-regenerate. So, kapag na-damage or may disease ang nephrons, hindi kayang palitan yun ng kidneys. However, the remaining healthy nephrons can adapt and take on the workload of the damaged nephrons para ma-maintain ng kidney yung function niya even with some damage. Kasi wala kang makikitang signs and symptoms until a large number of nephrons are compromised, usually around 25% of normal function. So, example, kapag nag-undergo ng surgical removal of one kidney, yung isang tao, yung nephron in the remaining kidney can undergo hypertrophy, yung magkakaroon ng enlargement para ma-handle niya yung increased workload. Okay, now dito naman tayo sa processes of urine formation in the nephron. So, meron tayong three essential processes for the formation of urine. So, meron tayong glomerular filtration, tubular reabsorption, and tubular secretion. Alright, the first one would be the glomerular filtration. Yun yung first step in urine formation. So, dito, water and most solutes in the blood plasma move across the glomerular capillary wall papunta sa may glomerular space, sa may Bowman's capsule. Nagkakaroon ngayon ng formation of the glomerular filtrate. Now, yung glomerular filtrate na yon magfo-flow into the renal tubule. No? Tas punta tayo dito sa second part, tubular reabsorption. Yung tubule cells kasi kaya niya mag-reabsorb ng about 99% of the filtered water, pati na rin yung mga essential solutes, kagaya ng mga glucose, amino acids, and other electrolytes. So, anong nangyayari ngayon dito sa tubular reabsorption? No? Yung mga na-reabsorb natin ng mga substances babalik sa bloodstream via the peritubular capillaries and vasa recta para ma-make sure natin na yung mga essential substances na kailangan ng katawan ay mariretain natin. Hindi natin yun maiihi. No? Most especially yung mga important nutrients and electrolytes. Important note na maalam yung difference ng reabsorption and absorption. Pag sinabi natin reabsorption, more on return of substances back into the bloodstream. Pag sinabi natin absorption, no, it refers to the substances entering the body, like say for example sa GIT or gastrointestinal tract. No, after ng tubular reabsorption, mayroon na tayong tubular secretion. So, sa step na to, yung renal tubule collecting duct, nagsisecrete yan ng additional substances into the filtrate. So, pwede tayo magtapon dito ng waste products. No? Pwede mo iihi yung waste products dito. Like urea, creatinine, drugs, excess ions kagaya ng hydrogen, mga potassium, ammonia. So, dito, yung blood in the peritubular yung substances are moved from the blood into the peritubular capillaries into the filtrate para ma-remove natin yung unwanted substances, ma-maintain natin yung proper blood pH and electrolyte balance. So afterwards, nagkakaroon na ng excretion. So meron na tayong urine na magde-drain sa minor calyces, major calyces, and eventually pupunta na yan sa renal pelvis and ma-excrete sa body via the urinary tract. Okay? Now, dito tayo sa glomerular filtration. Again, yan yung first step in urine formation. The fluid and solutes from the blood plasma are filtered in the glomerular tube. Now, the fluid that enters this space is known as glomerular filtrate. Now, the fraction of blood plasma that enters the glomerular capsule is what we call as filtration fraction. So, in average, ang mga adults kasi, mga average adults, nakakagawa sila ng approximately 150 liters ng filtrate sa female and 180 liters sa male. No? Ang dami-daming filtrate na nagagawa. However, despite the large volume of filtrate na na-form, only 1 to 2 liters lang ang na-excrete as urine. So, parang more than 99% na-reabsorb back into the bloodstream during the subsequent processes in the renal tubules. So, dito tayo sa filtration membrane. Ang filtration membrane kasi natin dito, it is formed by glomerular capillaries and podocytes. Yun yung nag-encircle sa my capillaries. And they are selectively permeable. Meaning, kaya niyang mag-allow ng water and small solutes to pass through, pero nape-prevent yung mga pagpasok ng mga blood plasma, mga plasma proteins, mga blood cells. No, hindi nakakapasok yung mga yon kasi mas malalaki sila. Now, 3 layers ang filtration membrane. Meron tayong glomerular endothelial cells, basement membrane, and the podocyte filtration slits. So, unahin natin yung glomerular endothelial cells. No, meron yung fenestrations or pores na around 0.07 to 0.1 micrometer ang diameter. No, yung mga butas na to, yung mga fenestrations na to, kaya niyang mag-allow ng mga small solutes sa plasma, except blood cells. No? Magpapass through yan sa glomerular capsule. Again, yung mga fenestrations, kaya niyang mag-allow ng mga solutes sa plasma except blood cells to pass through the glomerular capsule. Meron din tayong mesangial cells dyan. No? Pag sinabi nating mesangial cells, contractile yung mga yan, which help regulate glomerular filtration by adjusting the surface area for filtration. And then we also have here basement membrane. Ang basement membrane kasi, meron niyang collagen fibers and negatively charged glycoprotein. No? Since negatively charged yan, i-repair niya yung majority ng plasma protein kasi mga plasma proteins natin, they're also negatively charged, no? Para ma-prevent yung filtration nila. May mga spores din kasi ang basement membrane na nag-aalaw ng water, small solutes to pass through. Right? Now, dito tayo sa podocyte filtration slits. Pag sinabi natin podocytes, para silang foot, no? Foot-like processes of pedicels na nag-wrap around sa glomerular capillaries. Now, yung mga foot na yan, merong mga gaps known as filtration slits. Na yung mga slits na yon is covered by a slit membrane. No? And that slit membrane allows the passage of molecules with a diameter smaller than 0.006 to 0.007 micrometers. And that includes water, amino acids, glucose, small plasma proteins, ions like sodium, potassium, urea, and ammonia. Now, ang albumin kasi yan yung most abundant plasma protein na meron tayo and meron siyang diameter na 0.007 micrometers. Kaya partially filtered lang yan. Pero, less than 1% lang ang nagpapass through kasi sa size niya. Tingnan natin ngayon yung mga factors na pwedeng maka-affect sa glomerular filtration. The first one would be the large surface area. No? Kasi meron tayong mesangial cells na nagkocontrol ng surface area mo para by contracting and relaxing. Kapag relax, yung surface area maximize, no? Mataas ang filtration. Pero pag nag-contract, yung surface area bababa. No? Filtration is also reduced. We also have thin and porous filtration membrane. Ang filtration membrane kasi natin, 0.1 mm thick lang thick lang yan. So, it allows for efficient filtration. Yung glomerular capillaries din natin, 50 times leakier, no, compared sa other tissues. Kasi malalaki yung fenestrations nila, yung mga butas nila. Madali lang makadaan yung mga small solutes. And number 3, we have high glomerular capillary blood pressure. Ang efferent arteriole kasi, smaller ang diameter compared sa afferent arteriole, no? Nagkakaroon tayo dito ng resistance to blood flow. Yung resistance na yun, nagkukos yun ng high blood pressure within the glomerular capillaries. Okay? Dito naman tayo sa net filtration pressure.